So now, we want to look at the different classifications of what acute kidney injury and look at their pathophysiologies. So when we say that an acute kidney injury is happening before the kidneys, we call that pre-renal. If the injuries are happening within the kidneys, we call that renal or intrinsic. If it is happening after the kidney, we call that post-renal. You understand? So for acute kidney injury, it could happen at these different regions, okay, and it forms a basis of what classifying the disease condition. So let's look at the pathophysiology of each one of them. So understanding the pathophysiology of acute kidney injury involves you are trying to actually identify how the disease condition actually came about. So you are looking at the different classifications of acute kidney injury, and you are looking at the possible things that could actually cause an acute kidney injury at that region. So for pre-renal acute kidney injury, that's the disease condition is happening before the kidneys. It's definitely due to what? The blood flow to the kidney is being obstructed. Okay, so there's reduced renal perfusion. Okay, so kidney responds by activating the renin-angiotensin-aldosterone system to retain sodium and water. So if the hypoperfusion persists, okay, the blood supply to tissues is not adequate, so ischemia sets in. So common things that could cause reduced blood flow to the kidneys is if the person is dehydrated, the person has bled so much, heart failure, sepsis. There's some medications like non-steroidal anti-inflammatory drugs, angiotensin converting enzymes. Their side effects is all of this. So intrinsic acute kidney injury, this one, there's an injury to the kidney itself. So the damage can occur in the glomeruli, it could be the tubules, it could be the interstitium, it could be the blood vessels. Okay, so common type is acute tubular necrosis due to ischemia or nephrotoxins. Inflammatory response and cellular injury disrupt filtration and reabsorption. So other things could be glomerulonephritis, interstitial nephritis, vascular disease like inflammation of the blood vessels, thrombotic microangiopathy. Okay, so post-renal, that's issues happening after the kidney itself. That's in the ureters, in the bladder, in the urethra. Okay, could be obstructions. So prolonged obstructions could lead to urine being built back in the kidneys. That's what we call hydronephrosis, and the tubules will eventually get damaged. Okay, common things that could cause obstructions or strictures, kidney stones, tumors, enlarged prostate, urethral strictures. Okay, so if the obstruction is on one side, the prognosis is better. If the obstruction is on two sides, then you are dealing with a much more fatal condition.